Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the right side of the health. In this video, let's understand how cerebral palsy can be managed with the help of physiotherapy. Now, there are many parents who must be watching this video and should be going through physiotherapy for their children. But do you exactly know what is the role of physiotherapy? Why physiotherapy is needed? Well, if not, then this video will give you that understanding. So friends, what is cerebral palsy? Cerebral palsy is a condition in which there is damage that has happened to the brain. Sometimes there is death of the brain cell as well due to hypoxia or due to challenges that happens before birth, during birth or after birth during the first year of life. Due to this, the areas where the damage has happened, those functions gets impacted, and due to which child's ability to do functional activity gets affected. Child's overall development gets affected. So the child will show delayed developmental milestones, and at the same time, the child's muscle tone will also be altered. Some children have got very tight muscles which are called spastic muscles. Some children will be dystonic, which means sometimes these muscles will be tight and sometimes these muscles will be loose. And sometimes the children are ataxic, which means they would be doing a lot of shaky movements compared to a lot of tight movements. In all of these scenarios, unfortunately, there is no cure, but there is a very strong need of physiotherapy so that the physical functioning of the child can be maintained and child can be taught all the physical activities that he or she needs to perform in the day-to-day life. With this idea in mind, this goal in mind, physiotherapy is done. Many times, parents are under this impression that physiotherapy is required to cure the problem. Unfortunately, that's not the case. Physiotherapy will never cure cerebral palsy, but physiotherapy will make sure that the child is able to walk or is able to attain the functional independence based on his or her muscular functioning. And that's what is role of physiotherapy. Ideally, the physiotherapy, sooner it is started, the better it is for the child. Because in the early days, as the child is young, the muscles are more softer, the bones are more malleable and flexible, and the more sooner we start, the better brain involvement will also happen and better results can be seen. So if you are a parent who has got very young child, don't wait for your child to grow up. Start your physiotherapy as soon as possible. Do you know there is something called as early intervention physiotherapy? Yes, physiotherapist role actually starts in the NICU itself. So there's nothing that you should wait for certain age and then only start physiotherapy. In fact, the sooner you start, the better it is. So what exactly a physiotherapist will do when your child is suffering from cerebral palsy? So based on the assessment, based on the analysis, the goals are basically divided in three things. Number one, tone management. Number two, postural training. And number three, progressive exercises again. So when it comes to tone management, the idea is to reduce spasticity of the muscles. If the muscles are dystonic, the idea is to bring a very consistent tone in the muscles. And if the muscles are ataxic, then the idea is to reduce that level of ataxia, for which a physiotherapist uses techniques like deep pressure or else deep joint compression, or else sustained stretching exercises, or holding a stretch position for a long period of time. Along with the stretching exercises, sometimes gentle sensory therapy or else touch therapy with the help of gentle massages also helps in reducing the tightness around the muscles. The next thing or the next goal that comes into the mind of a physiotherapist after working on the muscle tone is positioning. Now, when we are living a life, we incorporate a lot of different postures, a lot of different positions. For example, I'm sitting right now. Sometimes we have to stand, sometimes we have to sit cross-legged, sometimes we have to sleep in certain positions, right? But the child who was born with cerebral palsy will never get an experience of what is the right way of sitting or standing, because the developmental milestones itself are delayed and are altered. And that's why it becomes very mandatory for a physiotherapist to introduce to these different postures so that he or she gets an awareness of what is the right posture feel like. Apart from that, when the child is sitting or sleeping in the right postures or positions, the joints will stay in more alignment. The muscles have to overwork less, and thus it will help in improving or getting nearer to the developmental milestones. That's why physiotherapists usually recommend the child to sit on corner chairs, to stand on standing frames, or else be in prone-like position or tummy-time position. Apart from this positioning, the next thing that physiotherapists work on is attaining the developmental milestones and physical functioning. Now we all know that as we grow during our childhood, we attain certain milestones. For example, when a baby is born, the first thing that he or she will attain is the neck control. That means her ability to lift the neck and hold the neck erect. Followed by this, the child is able to roll from one side to other. Child comes to crawling position. From the crawling position, the child comes to learn to sit independently without support. All of this happens gradually. But unfortunately in cerebral palsy, all these processes are delayed. And during this delayed process, it's important that training should be done in developing these milestones. That's where the role of physiotherapy comes in. Physiotherapists train the child to get or attain these milestones with the help of repeated exercises. At the same time, the therapist also focuses on the day-to-day functions that the child is able to do. So for example, if the child has attained neck control, then the next goal that the therapist have in mind is to train on coming to crawling position or else sitting independently, for which therapists train the child using different activities and exercises. As it progresses, as the child develops the ability to sit independently, then he requires to move on to teaching sit to stand. From sit to stand, the therapist might have to teach the child from coming from side sitting to sitting position. Similarly, he needs to progress from sitting to standing, standing with holds and then walking. That's how the progression is maintained. But that's not all. Physiotherapy has to be continued lifelong, because as the child will grow, as the child will attain developmental milestones, as growth spurts will come, there will be changes in the muscle. There will be changes in the mindset, which could increase stiffness, spasms, and could lead to development of deformities and contractures. It's very important for the physiotherapist to keep an eye on all of these and thus gradually work on preventing these contractures, these deformities, and delaying surgery as much as possible. To prevent this contractures and deformities, physiotherapists also recommend or prescribes different footwears, different belts, or different assistive tools that helps the child to attain the right posture. That's what is the role of physiotherapy when it comes to cerebral palsy management. It's important that parents work in collaboration with physiotherapists and other team members like occupational therapists, speech therapists, etc. to attain the developmental milestones that are key for living a normal functional life. This is the role of physiotherapy when it comes to management of cerebral palsy. I hope you found this video informative. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.